can run deficits, you know, of 2% of the economy or whatever without too much of a problem. The difficulty is we're headed to uncharted territory. In the last 6 years alone, the total liabilities and unfunded commitments of the United States government, the totals have gone from 20 trillion, now there's 12 zeros to the right of that 20, to 50 trillion in 6 years. A 147% increase in 6 years.
50 trillion is $440,000 per American household. Median household income in America is less than $50,000 a year. That means that the typical American household has an implicit burden, mortgage if you will, of 9.5 times their annual income. But unlike a typical mortgage, there's no house to back this mortgage. The only asset that people have is their citizenship, which gives them unparalleled opportunities to maximize their potential and their earnings. But there are no hard assets. And that number, that $50 trillion number, is going up $3 to $4 trillion a year by doing nothing.
How do you translate $50 trillion to something that you and I and others might be able to relate to? Well, $50 trillion is 95% of the estimated total net worth of every American, including Bill Gates and Warren Buffett. That's up from 91% last year. It will pass 100% within the next 2 years on our present path.
Many people believe that the cost associated with the war in Afghanistan and Iraq is the reason we have these deficits. Clearly, those costs don't help. They're over $100 billion a year. But our deficits are much larger than that. And the thing that we need to keep in mind is Iraq is temporary and Afghanistan is temporary. We don't know when it will end. We don't know at what total cost in lives as well as dollars, but we know it'll end at some point. The challenges that we face in the long term are structural challenges. They're driven by demographics. They're driven by healthcare costs. They're something that we need to start doing something about because they're not temporary.
In 1950, we had 16 people working for every person drawing a Social Security benefit. Today, it's 3.3 to 1. By 2030, it's going to be about 2 to 1, and it's going to stay about 2 to 1. All right, so this is not a temporary problem.
I voted for a Social Security reform plan in my very first year in Congress. I was 30 years old then, and Social Security was in a financial bind. And so what we did is we cut benefits and raised taxes. And having cast that vote to put Social Security back on a sound financial footing, I began to reflect, what if this ever happens again? Is the best we can do for each generation is to give them less benefits and higher taxes? There's got to be a better way. And then I looked at the fact that the extra payroll taxes we were collecting based on those higher revenues we voted for in the early 1980s weren't honestly being set aside to finance the future of the program. And I just thought, this is just not right, that we collect all this money intended to help us finance retirement, but the money gets spent elsewhere, and we're not budgeting in a way that's going to make it easy for us to return that money when it's needed. And that actually led me to think maybe this money ought to be in personal accounts that the government can't spend.
You know, many young people think that Social Security is not going to be here for them. They're wrong. Many older Americans think that their Social Security benefits are going to be taken away from them. They're wrong too.
I think that in order to sort of build up the political courage to tackle the rest of these budget challenges, politicians need to gin up enough courage to tackle Social Security, which in many ways is the easier program to fix. It's not that these are small problems, but they're more manageable, and there aren't as many moving parts.
From a practical standpoint, our Social Security challenge is about $6 trillion out of our $50 trillion imbalance. We can reform Social Security and exceed the expectation of every generation of Americans.
If we want to fix what's wrong with Social Security, if we want to avoid this funding shortfall and also put the program in a position where it can honestly pay benefits in the future, we've got to do a couple of things. We really do have to have some benefit restraint. That could be limiting COLAs only to those that need them. It could be raising the retirement age in some way, shape, or form. But something has to happen on the benefit side to reduce this huge, huge wave of unfunded costs in the future. And then I think we need to start pre-funding retirement so that within the Social Security system, some of those tax dollars we pay are actually invested in a fund, a mutual fund that will grow and draw interest on our behalf. And I think that combination will put the program on a sound financial footing for the long term. And it seems to me that's the only fair solution for the next generation of workers coming along.
It's the #1 fiscal challenge for the federal government, it's the #1 fiscal challenge for state governments, and it's the #1 competitiveness challenge for American business.
Of that 50 trillion, 32 trillion is Medicare alone. And the new prescription drug benefit was $8 trillion. By the way, $8 trillion is more than the unfunded obligation for Social Security. So Medicare is a huge problem, but Medicaid's a problem, and our general health care system is a problem as well. It's our #1 domestic policy challenge.
Let me give you a few stats on health care. We're #1 in spending. We spend 50% more of our economy on health care than any industrialized nation. #2, we have below average life expectancy for an industrialized nation. We have above average infant mortality. We have above average medical error rates. And we're #1 in the world in obesity, which is the leading indicator of diabetes, heart disease, and a variety of other things, okay? My personal view is that 20 years from now, and hopefully before 20 years from now, the division of responsibilities for health care will be dramatically different than it is today. And I'll give you one possible future, okay? That one possible future is that the federal government, which is the largest risk pool and the largest financing source, assumes financing responsibility and the risk for providing basic and essential health care services for the entire population in lieu of the hodgepodge that we have now, all right? And basic and essential might include inoculations against infectious diseases, certain wellness services, protection against financial ruin, guaranteed access to additional insurance if you want at group rates, but you got to pay for it. And you can either get it through your employer's compensation package or otherwise. That's the first element. The second element is there's got to be a budget for the federal government on how much it spends on health care. Otherwise, the federal government will continue to charge the credit card, and our kids and grandkids will end up having to pay it off with accumulated interest. Thirdly, we need to have national practice standards and leverage technology to improve consistency, enhance quality, reduce cost, and reduce litigation risk. And fourthly, we have to structure our healthcare system where there's more personal responsibility and accountability for your own health and wellness. We've got to do all four of those things. I think if we do all four of those things in installments over time, we can have a system that's solvent, sustainable, you can get universal coverage cheaper.
Your Child's Inheritance, Debt, is a co-production of For Our Grandchildren, a Social Security education program, and TPT's Minnesota channel, with additional funding provided by Skyline, a national designer and builder of trade show exhibits.